Welcome back to the Better Arizona Show. I'm Sarah Karlstrom. Are you one of those people who seem to eat right and exercise, but no matter what, you can't seem to get rid of stubborn areas of fat? Well, that is what we're talking about today. I've got Dr. Molly Walsh from Forma Plastic Surgery. And Dr. Walsh, who doesn't have a couple pockets of fat that they can't seem to get rid of?
Yeah, you're right, Sarah. Everyone seems to have a certain area of their body that they just cannot seem to get the way they want it.
And so what are our options out there? You hear liposuction, it seems kind of like a drastic measure, but it's not. I know things have really changed.
Right. You know, liposuction these days is a relatively safe procedure for the right candidates. There's many different forms of liposuction. You'll hear about lipo, ultrasonic liposuction. They're all doing basically the same thing, where fat is dissolved and then removed.
You talk about the right candidate. Who is the right candidate for liposuction?
You know, patients obviously want to have a good general overall health. They want to have a good diet and exercise program. And younger patients who are healthy are the good candidates for liposuction. It shouldn't be used as a weight loss tool.
That's what I was wondering, because it's like I was saying, it's we try, we're eating right, we're exercising, but we can't seem to get rid of these pockets of fat. Is there
right.
Are we in 25 pounds of our goal? Is that the ideal candidate?
Yeah, those are good candidates. Just those little stubborn areas, love handles, hips, abdomen, that just don't seem to want to go away with the diet and exercise.
And it does go away with liposuction. Explain to me exactly what happens when someone comes in here in the procedure.
When someone comes in, we evaluate what their concerns are, determine if they are a good candidate for liposuction. If they decide to proceed, we usually do our liposuction procedures under general anesthesia. Post-operatively, patients will have a little bit of swelling and bruising, but usually they can be back to work the next week.
Really?
Mm-hmm.
So not a lot of discomfort with this kind of procedure?
Soreness more so than discomfort.
And with something like this, how soon do you see results? Is it something that I'm going to notice right away, or is it something that over time you'll be able to see?
It's something that you notice right away, but then there is a gradual improvement that 6 weeks to 3 months later, you'll see the final result.
And so you talk about dissolving fat. Is it that you, how do you do that exactly?
Sometimes that's done with laser, sometimes with liposuction, sometimes ultrasonic liposuction, or even just traditional liposuction. We use cannulas that aspirate the fat.
You know, I've heard a lot these days, people talking about things, it's not liposuction, but they're removing fat maybe from one part of their body, they're placing it somewhere else. What do you know about that?
Fat grafting. That can be a great adjunct to other plastic surgical procedures of the face, of the buttocks. It's one of the hot topics in plastic surgery these days.
Is that something that you're doing here at Forma Plastic Surgery?
It is. We do it both in reconstructive procedures and in cosmetic procedures.
And I know we have a lot of before and after pictures of what people look like before and after they've had any of these procedures. And when you hear from your patients, typically, what do they say to you?
Oh, they're just so happy. Just these areas that they've been working on for so long finally are where they want them to be.
And it's not an invasive procedure, and like you said, very little downtime,
right.
Very little discomfort, but a lot of people feeling better about themselves when it's all done.
Absolutely.
Well, if you want to know more about liposuction or any of the other treatments that they offer here at Forma Plastic Surgery, you can get on their website, take a look. You can even call and make a consultation. That's formaplasticsurgery.com, and appreciate all the information, Dr. Walsh.
Great talking with you today.
All right, to the Better Arizona Show. We'll be right back.